Hello, everybody. Thank you for inviting me to Vilnius, Lithuania. I'm sorry I lost my voice, maybe because of changing the weather. I get some kind of flu. Let me introduce myself. My name is Dr. Amir Ibrik. I graduated it from New York University in USA, and I was practicing there for 12 years, and now I'm practicing in Qatar, which is the World Cup is going to be in 2022. And also I am working as a full-time job as the scientific affair with the Harvard Dental. So thank you very much for coming. I can see all, like a lot of you, it's young dentists, ambitious. We're trying to talk about our product and about aesthetic dentistry, especially that all the new generation, they like to make a new composite filling material with aesthetic dentistry. So let me talk about the Harvard Dental. It's a Harvard Dental. The company, it's in the past and the present. I don't know, most of you, they know the Harvard from the zinc phosphate cement, that it's been established 1892 by Dr. Robert Rechters. He is a German dentist who graduated it from Harvard University in USA. For that reason, he called it a Harvard. And he returned to Berlin in 1890, and he established his own company. And he made the first formula regarding to the cement, the phosphate zinc cement, that is the same recipe it's keep using until now, those days. So most of you, if for the people also who graduated long time ago, they know about this cement. It's one of the best cement on the world for the phosphate cement. Now for today, Harvard company is now doing a lot of the dental material for restorations, for restorative dentistry. For endodontics, we have a very good MTA, and also for prosthodontics. Prosthodontics, we have the impressions material, we have a post-encore material for build up the tooth. But today we are not going to talk about all this product. We will talk about just the restorations, composite, and a little bondings. And I try to give you tips and tricks how to avoid having sensitivity while you are putting the composite filling material. Because most of the composite filling material, that when you put it, you will face some sensitivity. So try to avoid it, and we will give you the tips and tricks. So those are all the products that the Harvard doing these days. We have the composite, bonding, liner, glass enamel cement as a filling, and we have them as cementations. For endodontics, we have a pulp capping and root canal MTA. For prosthetic, we have a very good bite registration material, one of the best in the market, impression material too. And we having also new products that I didn't speak about them and we didn't put them here. We have, it's called the newest, fastest impression material. It's called Fast of the Fastest, and we have a new material called BioCal. This is for direct and indirect pulp capping. It's an MTA resin modified cement that you can apply. This is new, and you can see it here in our dealer. We have a dealer here in Lithuania. So let's talk about restorations, that the composite filling material is like your daily bread, that every day you do those cavities and you do those fillings. Every single day you have cavities, people asking for fillings. So we are going to be talking about the full nano composite and nano hybrid composite. And what does it mean when we say full nano composite, nano hybrid composite? The name is come from the fillers that you have inside the composite. So I will speak about restoration. What does it mean in the language? Restoration, it means dental filling treatment that is restore the function, the integrity, and the morphology of the missing tooth structure from caries or external trauma. This is in the name. What does it mean in language? Composite, it's made up of this part or separate part combined together. Combine those elements and you will have composite. So the composite, it's meaning the compound two or different material together to create the composite. Now I will go with the basic that you study it in the dental school, the composition of the composite. You have the matrix, and you have the colors agent, and you have the fillers. Those fillers that who give the names to the composite, it depends how they cut them. Is it nano or micro or nano-micro hybrid? So the composition of the composite in general now we are talking. As we said, we have a resin matrix, filler, curing agents, and coupling agent and coloring agent. The resin matrix, it's usually we have the triethylene glycol dimethacrylate. It's a low viscosities. And with the urethane dimethacrylate, it's the high viscosity. So in order to make a composite, you cannot mix high viscosity with high viscosity. You need to use high with the low viscosity in order to have a nice combination. And the mixture of these resin provides you give good viscosity needed for binding the compounding of the fillers. So you have the matrix, the resin matrix, as we said, different material. They combine it to each other. You cannot put, as I said, high with high. It should be high with the low. Then you can add the fillers, on instance, the barium class, the silica, the zirconium dioxide quartz. This is part of the fillers, and those are very important. Why? Because it will prevent you from having the shrinkage. So if the composite have a nice fillers, then you have a low shrinkage for the composite. And if you have a composite with very low shrinkage, that means you have a very good composite, because your enemy as a composite filling material, the shrinkage that it will happen during the applying the composite fillings. And also the filler, it will help for resistance the abrasions that you will create during the mastications. So the better the fillers, the better the composite for long-lasting the composite filling inside the patient mouth. Now the coupling agents, these are organic silans that it's make the link between the resin and the fillers. So these are the coupling, it's make the integration between the resin and the fillers. And the last thing is you have the coloring agent who give the composite resin the filling and achieve the tooth coloring. So when you have the color A2, A3, A3.5, it depends about the coloring agent that they add to the composite filling. Now, for the Harvard dental material that they have, as we said, ultrafill, which is a nano composite filling. And we have the Harvard ultrafill, it's composite flowable composite material. And then we have a very nice and very unique Interlock One universal adhesive. When we speak about universal adhesive, that means it comes with one bottle, that it has the phosphoric acid inside, and it has the prime and the bonding in the same button. Then we have the self-cure activator. What does it mean? If you are going to use this one for inside the root canal for cementing the post and the light cure, you cannot go through the root canal. You need to add the self-cure activator to the interlock in order to have the working for the adhesive inside the root canals. So now regarding to the Harvard Nano, This is the, as we said, it's a nano, it's opalescence. I will explain to you what does it mean, opalescence. It has a natural opalescence look. It's very easy, high gloss polishable, that you can polish it very easy. It's very good handling. It doesn't stick to the instrument that you are using because you need a composite filling that is not sticky. And it's very easy to mold it with the tooth, inside the tooth, or inside the cavities. And it has the chameleon effect that you can add and mix A2, for example, with A3 or A3.5. So it has the chameleon effect. And it's very important, we spoke about that it has a low shrinkage. This is very important, and high mechanical strength. High mechanical strength, that it means that the composite filling can resist wearing off during the mastications. This is also very important in order not to have later on sensitivity. So opalescence for the nano composite material, you can use it for multi-opacity layering technique. This is what we mean opalescence. This is what mean opalescence. When the background is black, you can see it as blue. And when the background is white, you can see it as the color is white. So the opalescence, it's contained inside the composite filling. This is one of the clinical cases. We add the incisal edge. It has different opacity than the dentine and the enamel, and we will be speaking about it later on. So this is another case from one of our doctors who did it. You can see here the dovetail, the filling that it shows. This is who come to his office, and the patient complaining regarding that it will shows here that the composite filling is not matching with this tooth. So this doctor, he used to do the bleaching. He did the natural bleaching for this tooth, and then he applied a multi-layering technique here, that he used the enamel opacity, and then he used the incisals edge. And this is before, it showed the dovetail. Here it doesn't show, it's blended between the structure of the enamel, the dentine, and the composite filling. This teeth, you can see it those as a sample. We crafted them in Harvard Dental, and you can see them as a sample here with our dealers, like incisals teeth. Here we are trying to explain what does it mean, the multi-layering technique. When you have a dentine, the opaque is 90%. When you have it enamel, it's less, 80%. When you have it as an incisal edge, you have it as a 70%. Again, I'm talking about the opaque. And when you have a transparent, 60%. And in our composite, we have extra transparent too, which is 50% opaque. This is, you will see it as a final after the finishing and the polishing. This is the dentine. You can see it as a dark. This is the enamel. This is the incisal and the transparent, and you can see the bluish coloring here, and that's what we meant by the opalescence that inside. So these ultrafill, it's very nice for aesthetic dentistry, and also it's very nice to have it for posterior teeth as well as anterior teeth. This is another case that we close the diastema. This is the initial situation. This is the final. See how it's the coloring, you cannot distinguish it. Where is the filling? Of course, as a dentist, you will know that the filling, it was here, because here it was a space, and here is closed the space. So really this composite filling that I've been working now with this composite filling as an ultrafill, because I'm still a clinician and I'm still practicing in Qatar. So it's really very fantastic material that you can use. And you can see it here, it's blended. You cannot distinguish where is the composite filling and where is the tooth structures. This is the chart. It will show how is the colors that we have. We have a very big numbers of the coloring, and I will explain to you with the multi-layering technique. And if you don't want to use multi-layering technique, what does it mean, multi-layering technique? It means that you use enamel, dentine, incisal, and transparent. When we call it universal opacity, this is for the dentist who doesn't want to go sophisticated with this. You just want to put as just one layer, and we have it as a universal. So this is for multi-layering technique that you put enamel. E stands for enamel, and you have D stand for dentine. Then we have the bleaching color, bleaching 05 and bleaching. And those colors work very good on the Middle East area because, I don't know, they love to show this color. In Germany, they like to show more than A3, A3.5, or A2 as more brownish. This is another case that it will show that we remove the amalgam fillings and we put a composite filling. This is also from the ultrafill. And we use here the extensive dentine or intensive dentine to show and to look more natural from the inside. And we put A2 enamel here. It's really, I can say, the multi-layering technique, some dentists, they don't like it because they think that it's time-consuming and it's very difficult. But I feel like it's very nice to use it. And it just takes a couple minutes, but you need to keep practicing more and more in order to do it. So see the difference here between the amalgam, open edge, corrosions, old filling, and the new fillings. Oh, shit. This will go quickly. So it will look here more natural with these intensive dentine color, which is the opacity, as we said, it's like 90%, and then we put the enamel. And we choose here A2 enamel with the intensive dentine, and it looks more natural than the previous one. This is more closer. We make a zoom to the area and to the tooth, the posterior tooth, that we did a posterior teeth with this multi-opacity technique. Now, the very important question as a dentist, I don't know, as a practitioners, do you apply glycerin or you don't apply glycerin? This is very important questions. I guess you must apply glycerin. In my opinion, as a practitioner practicing for 30 years as a dentist, why you should apply glycerin. And it's come the tips and the tricks. After you're applying, even if you are going to use not multi-layering technique, if you are going to use the universal, usually we recommended you to put it as an increment, not exceeding more than 2 millimeter, then light cure, correct? I don't know if they teach you like that in dental school. You put the composite filling, then you light cure. You put composite filling, then you light cure. The final composite filling that you are going to put, before you light cure it, you apply glycerin, then you light cure it. Why? Because if you didn't put the glycerin, there is what is called the it will induce oxygen inhibitor layer, which is prevented from having the composite having a final polymerization. You know English, yes? Do you understand? So you will have inhibitor oxygen layer that it's prohibited you from having final polymerizations to the composite, and that it will affect your composite filling for the long run for the composite filling then, because the polymerization is not completed. So if it's not completed, then later on you will start changing the color of your composite filling. You cannot do a finishing and polishing very well and very good. So please, I recommended you to put the glycerine. Now this is if you have a class 1 filling material. If you have a class 2, what should I do? You put the strip, you know, the matrix strips for the class 2, and then you put the glycerine for class 1, and then you light cure it. Then you will do the finishing for the composite and contouring. Now the light curing, for me, is very important instrument if you are using a composite filling material. As a dentist and as a practitioners, when the last time you calibrated your light cure? After 5 years, 10 years, never ever calibrated? How do you know that your light cure instrument or device is working? Because, for example, for our composite filling, it should give you the light intensity, it should be 1,000 milliwatts per square centimeter. And it should be 400 nanometer to 500 nanometer the range. So it's very important that at least once a year you calibrated your light cure device or instrument for light curing the composite in order to find that what it's giving you, 1,000 milliwatt per square centimeter. And please don't buy cheap light cure that they found it in the market like 29 euro. I don't believe in this kind of light cure. It will never ever work. So it's better that you have a light cure that you keep at least once a year calibrated. And if it doesn't give you this at least 1,000 milliwatt per square centimeter that you need to change either your light cure or you need to change the bulbs. Because in the market now we have the LED, it's a diode, and you have the quartz tungsten halogen. So this is very important in order to have a nice composite filling material that it will last for a long time. So again, the guidelines for using the light cure. Maybe a lot of you as a clinician, you say this is not important. This is very important. It's extremely important in order to understand how the composite filling will work. First of all, when you light cure, you should be perpendicular, 90 degree. You should be as close as you can by 1 millimeter, not more than that. Now, some of you, they will complain that if I getting closer, it will generate heat, and then the patient start complaining about the heat, that he can't feel the sensitivity. First of all, I don't think so that you are doing a composite filling, especially if it's deep, without anesthesia. That means you are torturing the patient if you are doing the filling without anesthesia. So it's better always to put the anesthesia before you do any filling, even if it's the filling, it's inside the enamel. because the threshold for the pain is different from patient to patient. So it's very important, as we said, to calibrate it every year once, inspect the light, inspect the tip of your device. If it has any scratch or damage, that means also it's not providing enough light cure to do a good composite filling. As I said, it should be at the right angle always, and should read the instruction before you use it. And this is very important. I saw a lot of dentists, they are making the light cure, and they are covering the tooth with their hand, like this. So how do you know that you are light curing the same tooth or the tooth next to it? Please provide with the yellow glasses protection for you and for your dental assistant and for your patient. Otherwise, for long run, you will have inflammation on the dentina. And God forbid, for a long time, as a dentist, maybe you are not going to see anymore. So this is very serious. Try to put these glasses to you and to your dental assistant. Or you can use like this one, it's okay. This is an old machine for light curing. This is what we said, it should be perpendicular 1 millimeter close to the filling. So if you have the matrix holder here, this is class 2, start light curing not from the top. This is another tips and tricks. Start light curing from the proximal area first, then you go from the top. And after you remove the matrix band, light cure it again. This is one of the clinical cases we did that patient came with the abrasions. The abrasion here, he has it because it was heavy. He was trying to clean too much using the brush in the wrong way. So he cleaned his teeth very well, but he ended up with having abrasions. Here we apply composite filling ultrafill with the color we choose A2. So please, before you apply the composite filling, you should choose the right shade. And then when you decide it, for example, if you have a front teeth that you are going to do composite, it's good that you can apply it right away, the composite. Just apply it. Take it from the tube or from the tips that you have and apply it to the teeth just to see how it looks like before you continue or doing. And if the color is matching, then you go ahead and continue doing the composite filling. Now, this is, I don't know if it's helped you as a dentist. The flexural strength, this is when they apply a piece of the composite filling here, and they apply and they put the load and see when it will be broken. This is, it's more for the research dentist than for as a clinician. But just to tell you that, for example, it's 120 megapascal, and we have another premium fill plus, it was 136. So it's quite strong comparing to the other competitor. Here also the compressive strength that we make a sample of this. This is the composite filling sample with the height 6 millimeter, 3 millimeter as a diameter, and it will show when it's broke. And this is very important in order to have a very good composite filling. Is not just aesthetically it's good, it should be also holding the pressure. And here we found is 390 megapascal, and here 340 megapascal for the premium fill. I'm trying to go quickly because I don't want you to get bored. This is also, as I said, for researchers, if they want to know more about our composite filling. And also here is very important that the shrinkage is very low, 2.4 comparing to others. Some of our competitors, they have 2.1, but 2.1 to 2.4 is not a big deal. Here it will shows again, after brushing, this is the nano. After brushing their teeth, you feel that the nano, it's gone and removed. And our composite filling, this, it will stay for a long time, better than the other competitors. This is also for researchers, if you want to know. This is the ultrafill. This is the composite under the microscope, laser microscope. Here you can see that the adaptation is very well. Here you can see with the premium field that it shows the fillers. Here with the Evoclar, it shows the fillers. Here it doesn't show with the Filtech Supreme and the Ultrafill. So it's very nice when you have a nano, that it will, for polishing and smoothing, it will be very good and very excellent. Now this is, it's very important that Dr. Kunzelmann, he's a professor from Munich University, who did these studies. He found out that the tightness of the border of the class 2, after he take several shots and put it together in order to see the tightness between the ultrafill and our bonding, which is called intralock. And they found out that the result, excellent, no gap. Here they did the same with the competitor, the Brilliant Glow from Colton, and he found it's a big gap between the composite and the tooth. Here, no gap at all. And this is from Munich University, Dr. Kunzelmann, who did this. And he wrote to the conclusions, he wrote that in general, summarize that the bonding and the tightness between using the ultrafill and the bonding agent that we have, it's called intralock, it's excellent. And this is without using the total etch technique. And this is also some kind, I don't know if you are interested, found out 99.1%, 98% when the baseline and when is fatigue. This is when they light cure it and they put it on the water, distilled water for 24 hours, and this is after they use the fatigue. Now we'll go to the clinical cases. This is which is more important for you as a technician, as a clinicians. This is some of the cases that we did. This is the tooth number 11, 1-1. The patient complaining about, you can see here the fractures. The girl is 5 years old, fractures her teeth. It's very important, in my opinion, when you have a fracture for class 4, always make a mock-up and take index impressions before you apply. It will help you a lot. So here they do the mock-up and they took the index impressions, and here it shows the details. Then of course you apply the rubber dam, and then you put the impression index to show you where I should put the composite material, and you start doing this. Is with this kind of technique you need to use a multi-layering technique. So you put enamel, then you put dentine, and you choose the incisal edge that we have, and you can add into it also the transparent in order to have a natural tooth look. Of course, you put the etching, then bonding. This is Teflon to protect both teeth, because you don't need to work in here, you want to work here. This is what I meant when you put the impression index, then you try your material, it should be up to here. So you first put the enamel, whatever the color you choose. Then you apply over it a dentine. Then you put the incisal edge and the transparent. And then you apply the final enamel layer. This is how you do the multi-layering technique. This is how it's explained. And of course, you put the matrix between the teeth in order to have the interproximal area. And here the incisal edge, we choose the 70% opacities between the enamel and the dentine and the incisal edge, then transparent. Here we choose the A1 enamel. This is the same case. And it's very important if you heard about the memelon. Do you know what's mean memelon? This is very important in order to have a natural look teeth, especially for the central incisors. So you apply the memelon from the dentine, here the incisal edge, and then the last layer you put it is the enamel. And of course you will use the strip, not heavy contact, and this is the final product. You can see there is no any edge anymore. It looks like a natural tooth, and it's mimic this tooth exactly. This is also before and after, and this is the final result. This is when we have this. Sorry. And here it's gone. This is another case that the patient came and he doesn't like his front teeth, the 4 front teeth. Again, if you want to make for class 4, almost and always please use the index impressions and make a mock-up. Mock-up is very important. Either you do it by yourself or you take the impression, you send it to your lab technician. He will design the teeth for you, and you should show it to your patient before you do it in order to have an idea what kind of look, the final look is going to be after he took the final result. So here also again, put the Teflon, put the incisal, make those contouring and finishings, and then you polish them. And this is the final, changing the color even to more whiter. Here the enamel is dark. Now this is also a post-op 2 years. This is before, this is after 3 months. This is 2 years, this is 2 years and a half. No staining. The integrity of the filling and the tooth is still there. And the patient is very happy. So this is also what is called the multi-layering technique. Multi-layering technique is very important in order to have a final look, natural look, because the incisal is different than the cervical third of the tooth is more darkness than the middle third of the tooth, it's more whiteness. This is the same after 2.5 years, different perspective. We took different shot, and this is the final tooth. This is another case. Patient came, doesn't like his teeth, have a stain here. Old composite, you can feel the staining, and you can rid of all this The very important that when it's two things for the composite filling, especially for aesthetic dentistry. When you apply the filling, it's very shame, as you are a dentist, all of us, that the next day the patient will come and he's putting the filling on his hand. And he will tell you, look, doc, you're filling here. This is not good. So in order to avoid this, you should learn exactly how to apply the bonding. No matter how splendid and no matter how good the composite are, if you don't know how to use the adhesive, your filling is not going to last for a long period of time. And then later on, you will have those brownish line between the tooth and the filling. And this is not because of the composite filling is not nice. No, this is because of you. You didn't know how to apply a right bonding agent. And I'm not going to go on the details, but I guess you learn from your university. You're still young. Some of you graduated, some of you still not graduated. We have two types of bonding. They call it total edge. Yes? Did you hear about this? So you have total edge, and then you have the prime, and then you have the bonding. So this is what they call it, total edge, 3 steps. You etch, you prime, you bond, correct? Then you have total edge with 2 steps, phosphoric acid, then the prime and the bond come in one bottle. Did they teach you this or no? Then you have what it's called a self-etch. Please, you should distinguish. What does it mean, total etch? What does it mean, self-etch? Self-etch means that inside the bottle, either self-etch 2 steps or self-etch 1 step. Self-etch 1 step, all the dentists now these days lazy. They want everything in one shot inside the bottle. So they put for you the phosphoric acid, the prime, and the bonding. Please be careful how to use it. Read, it's very important. The most difficult thing is not to bond the composite to enamel. Enamel, it's very easy. The very important and it's very difficult how to bond the composite to what? Correct. Why? Why to dentin is very difficult? Because the dentin, it has 21% of the volume water and is connected between the pulp and the dentinal tubulus. So when, and the most, I consider it as an enemy to the dentist, the smear layer. Anybody heard about smear layer? Did you hear about smear layer? When you do the preparation for class 1 or class 2, or if you are doing veneer, you crushed the hydroxyapatite, correct? And you denaturalize the collagen, which is inside the dentinal tubulus, plus the saliva and bacteria. And this is what it's create the smear layer. So in order to have a very good, lasting, long composite filling, you should understand how the adhesive work. 2 things, don't make it very complicated. Either you remove the smear layer and demineralize the dentine, or you penetrate the smear layer in order to let the bonding integrated and have microdentine between the dentine and the composite filling. So remember just these 2 things. And most probability that I spoke about, that the composite filling, that you have the sensitivity is coming because of you as a dentist. you create more damage than you're helping the patients. For example, if you did a total etching very close to the pulp, then you will create sensitivity. If you didn't apply light cure how it should be, if it's not doing polymerization, you will have a sensitivity. And the most important thing, when you do the filling, you give anesthesia, correct? And then you have the articulating paper in order to remove if it's high. Please tell your patient to come next day when the anesthesia wear off, because 80% of your filling is still high. And when he continue biting, it will continue having pain. So you can solve the problem from having pain and sensitivity after the anesthesia wear off, bring the patient again and remove whatever is necessary from the composite filling. And please, please, please don't forget to polish. Polishing the composite is must. Don't do just by whatever you choose to use between tungsten, you know, the tungsten burr, or you have a diamond burr, and then this is not enough. Don't say, I stopped here. It's very important to polish the composite filling. If you didn't polish the composite filling, then the filling is not going to be lasting for a long period of time, and you will start having the brownish. So it's very important, whatever you choose, always use the polishing. It's very important. So this is, again, we did what is called the mock-up here, inside the patient mouth, in order to have the guidance how to do the preparation without taking too much from the tooth structures. Because this day what we have, a minimum invasive dentistry. You don't need to use the, I don't know, you still have these black class 1, class 2, class 3. Class 3, they used to tell you make a dovetail on the palatal in order to have more retention. This is not existing anymore. You just dig wherever the cavity only. Don't make any extensions anymore. So for that reason, we make a mock-up in order to reduce from the tooth structure removing. It's not necessary. Here we started prepping. Here also we did again and again and again. Very important, placing silicone index. Very important. And also apply Teflon. Always with the index, it will show you where's your preparations end, and it will show you where's your filling will be ending. Here it should be end, here. So first you will start with the incisal edge. Again, the same protocol, enamel, dentine, then final enamel. Please always put glycerine, always. Put glycerine when you have the final. And don't hesitate, it's not shame. I like to put a pencil in order to give you the secondary anatomy. And also I will let you use something also, it's very nice. Put your articulating paper, the one that if you have it red and blue, here, in order to give you where you need to remove for extra finishing and contouring, and for having secondary anatomy that it's look very natural to the tooth. So you can use the pencil, it's no big deal. And then you can do the preparation and do the polishing. So this is before, and this is after, with the multi-layering technique. This is the post-op 1 day. This is B1 enamel with A2 incisal edge. This is after 19-month recall. This is another case. Hear what I said, when you put the filling, and he will come back to you with these lines, brownish lines. Why? We said why. Either the light curing, it wasn't working good. The other thing I like always, if you have such kind of this, to make a wide bevel here on the enamel in order to splendid the composite filling. So you will add the composite filling up to here area. So it's not going to show as aligners between the tooth and between the composite filling. This is what we speak about. Why you have this? It could be bad habit that the patient smoke, insufficient light curing. The light cure, it doesn't go penetrate all the way inside. Not using a gut bonding, very good bonding, not use, or you didn't obey the instructions how to use the bonding with the total H. I like with this case to use the total H and primer and bonding. Total H for enamel and dentine, then apply the primer, then apply the bonding. So this is again what we said, why you have sensitivity, because bite discrepancy, we said, after you apply the filling, the composite, and put the articulating paper, the patient next time he will come to you and still feel high. So when he feel high, there is a pain. Or it could be from the bonding, you didn't apply the bonding, void. What mean void? There is a gap. Like you put more than 2 millimeter increment, maybe you put at a 3 millimeter increment, and you didn't do a very good composite light curing. Failure to remove the cavity. Tooth over dried or under dry edge. I don't want to go to these details, then you will feel very bored about, but those very important. This is very, very important. In order to have a very good composite filling, you should know how to use the bonding. No matter what kind of bonding you choose, 3M, Harvard, Coulton, Curare, whatever, you should know how to use it, when to use it, and why to use it. When you use total H, when I use selective H, what does it mean wet bonding? What does it mean dry bonding? You will have so much headache if I will continue like this. So I will stop not talking about bonding and adhesive. Bonding and adhesive, I need more than 3-4 hours to talk about it. Do you like this? One of my patients sent it to me after I finish her teeth. She thinks the dentist is a doctor, engineer, artist. And why engineer? Because the handpiece is broken and I tried to fix it. So for that reason, she sent it to me, this. This is kind of instrument I like to use, but you can use whatever you want to use as a reference. I like this from LM, and this one from Ivoclar and Vivadent. I like this one is condenser. This one is called Misura for measuring how much composite you need to apply in order to have a front teeth here. This one to remove the excess of the composite filling material, especially for class 2. And this is excellent in order to give you this tip and this tip for making the anatomy of the composite filling. Am I running late? Okay. Again, you can use whatever. It's very important, finishing and polishing. Please obey what they said, 5,000 to 7,000 RPM. Very important. This, if you use water. If you don't use water, use it just 1,000 RPM, not more than that. This is also some kind of Soflex, composite, polishing, whatever you want to use. Then here we have the ultra-field flow. This is very unique tip that it's moved 40 degree in order if you have a posterior upper or lower. Then this is also opalescence, very easy to use. It has filler 57% by weight, 48 volume. This is just for researchers. It's not interesting for the dentist. And you can do it for class 5, class 3, class 4. I don't recommend it class 4, this alone, because it's not going to stay. You can add it as a sandwich technique with the regular composite, not just like this one. And the very important, this one, it's called thixotrophic. Do you remember? Did you ever heard this thixotrophic? What does it mean? It means when you apply the material here, it stay here until you move it, then it's move. And this is very important for you because you don't want to do a class 5 composite and then the composite filling will end up with your gum. So this is what is the thixotrophic. Then we speak about the Harvard Interlock 1. This is the most important thing from this. This is, as I said, it's one bottle. The very important that it's the value pH 2.5, and this is what is most important. If you have the MDP in your bonding, then you have an excellent bonding. Why? Hydrophilic and hydrophobic. Do you know this word? Hydrophilic mean likes water, hydrophobic hate water. So you need this bonding that it will hold you the tooth like water, the resin composite hate water. So this is be as a mediator for you to have a strong composite filling material. And it's come like this, very unique, 260 drop. And it's when you drop it, it doesn't continue dropping. When you drop one drop, it's enough one drop. And then this is what we talk for the interlock for activator. This is what I love. I love this one. Total H with the primer and the bonding. It will give you very excellent composite filling. This is what we have, the transparent. You can see it in our booth that you can use it in order for you to have as a temporary crowns and bridges and for acrylic or for composite filling because you can see through it. And then I'm going to talk quickly about the Harvard Premium Fill. It's nano-hybrid. Nano-hybrid, that means the filler is nano and it has a hybrid particles inside. It's not just pure nano. Also, it's more, you can use it for posterior than interior. This is some of the cases that we use with the bond, self-etch mono, with the sandwich technique. This is, again, they make the same test with the Premium Fill Plus from Munich, and the result, it was excellent for the bonding. This is some of the cases that we did. Diastema closed with the same Premium Fill. Broken teeth, also fill it up. This is after what we did. It's called gingivoplasty. In order to have the gum, it's similar to the next to it. Then we apply the composite filling material as we explained. This is what it's called atrasions. And this is the also before and after. This is just some easy of composite filling your daily. And you have a flow also the same consistency like the Premium Plus. You can use it for class 5. Here with the border, here the final, no borders. It looks like natural teeth. And the last one we talk about quickly, Harvard Restore. This is a micro composite filling material. This is, we used it only for a posterior teeth. You can use it for anterior, but it's more for posterior teeth. And you have the Harvard Restore flow. Thank you very much. I hope that I did what is the best of the, and thank you for your attendance.